Hi, I'm Kristen, one of the nurses with the Home Infusion Pharmacy, here today to show you how to do a gravity infusion with a rate regulator on the tubing. So the first thing you want to do is clean a work surface in your home, either with a Clorox wipe or spray cleaner and a paper towel or soap and water. Then you just want to wash your hands good with soap and water and dry with a paper towel, or you can use hand sanitizer. After that, you want to get out all of your the things that you need for your infusion. So we have our medication. Some medications need to be refrigerated, and you may need to take that out of the refrigerator up to an hour before your infusion to let it warm up to room temperature. Other medications are at room temperature, so follow what the label says. You should also check to make sure that it has your name, your date of birth, and it's the medication that you're expecting it to be. So you're gonna have your medication, your IV tubing. We have 2 saline flushes, and if your doctor ordered heparin, you'll have a syringe that's blue. Could possibly be yellow, but most likely blue. We have alcohol pads, a red cap if needed, and our alcohol caps that go on the end of the line. So this medication has an outer cover, which I'm just gonna remove. Not all medications will have this. Okay, so there's our medication bag. And then you are going to open up your tubing. There's a little arrow here on the package that tells you how to open it. You can remove the paper tape on the tubing. You can just rip it off. Okay. Now stretch the tubing out. The clamp is always nested inside the little dial, so you have to slide that out and then pinch it closed. We have our end with the spike, which has a cover over it to keep it sterile. And then we have the other end that's going to connect to our IV device that also has a cap on it to keep it sterile. The little dial has an arrow, and if you can see, the arrow is set to open. It's always set to open when you open the new package. So we're going to twist the dial a little bit so it goes to the word underneath that, which is approx. That's where we want it to be when we're priming the tubing. Next, we're going to take our medication bag and pull off the blue seal there. Then you're going to take the cover off of your spike. You don't want the spike to touch anything, so you just want to put it right in the bag, and you're going to push and twist until it goes in far enough. Okay. Next, we can hang this up on the IV pole. Now, right now the tubing is full of air, and we want to make sure that the tubing is full of the medication before we connect it. So you're going to squeeze the drip chamber and let go, squeeze and let go, maybe twice, 2 to 3 times, letting it fill up approximately halfway. And then you're going to open your clamp, and it's going to fill the tubing with the medicine. We're just going to wait for it to fill the tubing all the way. Maybe see a little drop come out the bottom. Okay, and then be ready to close that pinch clamp once you see the medicine coming out the bottom. All right. Next thing we're going to do is make sure we set this dial to the rate that the medication needs to infuse. So that's going to vary depending on the volume of the medication and also how fast it needs to go in. So in this case, we'll just set it to 200. We're going to turn the arrow to the 200. If your medication needs to go in at 100 milliliters an hour, you're going to turn the arrow to the 100, and your nurse should help you just figure out how to do that. All right, next we're going to prepare the PICC line. So we have to open up our flushes. We're going to open up all the packaging. And we're going to remove this alcohol cap from the PICC line that just pulls off, and you can throw that away. Then you're going to take an alcohol pad and clean the end. And you want to clean it for 15 seconds. You're going to twist the sides and rub the flat part on top. We're just going to do that for 15 seconds. So it's been 15 seconds. And we're going to take our flush. We're going to take the cap off. We're going to pull down and then push up to get the air bubble out. And then we're going to push and twist these together. You may have to open up a clamp, or two even, on the PICC line. There's a purple clamp and sometimes there's a white clamp. And then you're just going to flush with the push pause. Okay. All right. So we just want to make sure the PICC line is working and that it's cleaned out before we connect the medication. Next, we're going to take another new alcohol pad and clean the end for 15 seconds. Once we clean the end, we don't want it to touch anything. If it does, you can just re-clean it. Then we're going to take the cap off of our medication tubing. And then we're going to push and twist those together. Okay. And then we're going to make sure all of our clamps are open on our PICC line and our medication tubing. Okay. And you'll know that your infusion is working because you'll see some drips dripping through from the bag into the drip chamber. So you just want to watch that and make sure that you are monitoring the time that you hook it up so that you can see if it's taking the correct amount of time. And you're just going to keep watching that. And once this stops dripping, then you'll know that the infusion is complete. So for teaching purposes, we're just going to pretend that, say this infused in an hour and the full hour is done and the bag is empty. So we're just going to close the clamp on the medication tubing and we're going to close the clamp on the PICC line. Okay. Now, tubing is used for 24 hours. So if you are only doing this once a day, you're just going to throw away the tubing with the medication bag attached and you'll get a new one on the next day. If your dosing is more than once a day, you're going to use the same tubing for the day or for 24 hours. So we need to keep the end of the tubing sterile. So there's a little package of a red cap to cover the end of the tubing to keep it sterile. So we'll just open that up. And we can keep it in the packaging until we're ready to connect it to the line. That way it stays sterile. Then we're going to disconnect this tubing. And sometimes it sticks in there, so you kind of got to wiggle it and then pull it out. We don't want this to touch anything. And you're going to pick up the larger end of the cap and then cover the end of the tubing. And you can keep it hanging here on the pole till you're ready to use it again. It would be best to try to keep the tubing filled with just the medicine. If for some reason you do end up getting some air in the tubing, you will just need to reprime it. Otherwise, you can just take the empty bag off and put the new bag on when the next dose is due. After we disconnect the medication, we just want to make sure we clean the PICC line again. So we're going to take a new alcohol pad. You should also wash your hands again if you've been doing other things and touching things in the environment over the time frame that the medication's been infusing. So we're going to clean that for 15 seconds. We're going to take our saline flush or sodium chloride flush. Pull down on the plunger, push the air out, and then we're going to push and twist the syringe onto the PICC line. Open up the clamp, and then we're going to flush with that push pause. Take that off, and then we're going to use the heparin last if the doctor has ordered heparin. We're going to clean before we connect again. We're going to clean every time we connect to the line for 15 seconds. Pull down on the plunger and push the air out. Then you're going to push and twist them together. And then we're going to push the heparin in. You can do this smoothly or use the push pause. Make sure you close your clamp before you take the last syringe off. And then we're going to take our alcohol cap. So this has a little wrapper where you're just going to pull the wrapper off, and then this just pushes together. Just push it on there. It's got a little gasket, and then you're just going to pull the cover off. And we want to make sure that this is on when you're not using the PICC line. It's going to prevent germs from collecting on there. Okay, and now that's ready to wait until the next time you need to use it.